Knockety knock knock. Hi Joe, I'm Morgan. I'm going to be your nurse today. And I'm going to identify the patient. I'm going to ask him his name, age, and birthday. And I can double check that with the wristband. He's my patient. I am going to be doing a abdominal wound dressing change on you. Is it okay if I take a look at your wound? He says yes. I'm going to ask him if he has had pain meds, and how is he feeling. He got his pain meds about 30 minutes ago, and he's feeling good. So I'm going to raise the bed to a comfortable working height. Okay, now I'm going to wash my hands and grab gloves. And I would put a glove over this hand normally. Okay, is it okay if I look at your dressing now? He says yes. So I'm going to pull it down but still provide privacy. And I'm going to pull the tape away from the skin, and I'm going to pull the abdominal dressing upwards so he does not see any of it. Okay. And I would dispose of that. And same with this. Dispose. Okay, this part might hurt a little bit, but we're just gonna get it over with. 1, 2, 3. You did great. Okay, now I'm going to observe the wound, look for any odor, smell, drainage to the wound. Your wound is looking great. So we're gonna go ahead and start the sterile procedure. I'm going to take off my other gloves and I'm going to wash my hands. And now I will go over to my table and I'm going to get my sterile field ready. Going to open this, only touching the back side of it and 1-inch margins. Okay, now I am going to pour my saline. I'm going to make sure it is not expired, and make sure it's saline and everything, and we're good to go. I'm gonna grab it with the label facing towards me so if I spill, it doesn't ruin the label. I'm going to open it. Okay, just going to pour a little in. And now I'm going to open my packages and drop them onto the sterile field. These two would normally be in packages, so dropping them. And then I'm going to make sure I open the packages facing away from me to keep sterile. And I'm going to dispose of that. And I'm also going to open my ABD pad, making sure it's away from me. And then I'll dispose of that. Now I'm gonna get my tape ready. Okay, now I would put on my sterile gloves. I would start with my dominant hand first, and I would make sure I do not touch the outside of the glove. Okay, yay. Now we have on our sterile gloves. Okay, so now I will take my Q-tip in the saline, and I am going to clean your wound, Joe. First I will start with the, I wouldn't normally touch my goggles. I will start with the side that is away from me first, and just go down. New Q-tip, and then I would go side closest to me. New Q-tip, go down the middle. New Q-tip, I go around the edge, making sure I do not lift up to break the sterile field. Perfect. Now we are all clean. Now I'm going to cut my gauze. These scissors don't like me. Okay. I'm going to get that wet in the saline. And then I'm going to take my forceps and I'm going to accordion it into the wound. And if the wound was big enough and I had to use 2 rolls, I would leave the tail out. So we made sure we had 2 rolls, we would know, and I document that in my charting. Now I will take my ABD, not my ABD pads, my gauze, and I will place it over. Then I will take my ABD pad and place it over. Now we are out of the sterile field because the wound is covered. This tape is only half, but pretend it's all. Okay. Now I will take off my gloves, wash my hands, and I will provide comfort for my patient, make sure he's all covered up, sat up if he wants to. I will report any findings to the doctor, and I will also chart any redness or anything I found in my charting, and I will clean up my sterile field and dispose of everything.